If there is one true benefit of having dealt with so many floods and cyclones in Queensland, it's that you get really good at knowing what to do when things look bad, like now with coronavirus. The most important thing is not to panic. We've made our plans and we're well prepared. Months ago, when this virus first appeared overseas, here in Queensland, we were getting ready. The virus is now here, but we had already started ordering extra supplies and getting fever clinics set up before it arrived. We are now tripling capacity in our emergency departments and doubling it in intensive care. Still, this is a once-in-a-100-year event. It is something we have never experienced in our lifetime. When we are faced with something like this, something none of us have ever experienced, it's only natural that people are concerned, stressed and anxious. That's why it's important to listen to advice from people who are able to provide accurate information, not some of the incorrect and inaccurate information that is being shared online. There are simple things we can all do to help us limit the spread of this virus. Simple things like staying home if you are sick. Simple things like washing your hands thoroughly and taking care to practice social distancing, which in simple terms is keeping at least 1.5 metres away from others. Together with other state premiers and the Prime Minister, we are closing our borders and isolating people who arrive from overseas because that has been the major cause of the spread of the virus in Queensland so far. Today I have announced that Queenslanders, to protect themselves, should not travel overseas. But we still need to do more, much, much more. The very way we interact with each other must change, and it must change today. Our lives and the lives of our loved ones, our family, depend on it. To cut the risk, we have stopped non-essential gatherings of 100 or more people indoors and 500 or more people outdoors. We are absolutely serious about this, so fines will apply to breaches. At the moment, there will be no changes to the way we send kids to school or to do anything like going to and visiting the shops. Schools and essential workplaces are necessary. The best medical advice tells us that closing schools before we absolutely have to means that workers, including doctors and nurses and paramedics, would have to stay home to look after their children, and we have to avoid that as long as we can. Places like shopping centres and train stations are considered low risk because people pass through quickly, unlike an event at the theatre. Some people who catch the virus will have a mild illness. But if you are an older Queenslander or have underlying health conditions, particularly respiratory illnesses, or you are in aged care, the virus can be deadly. Please read the advice to all Queenslanders that will be updated on my social media channels. Additionally, one of the best places to get information is the Queensland Health website. You can also call 13 Health. Please listen to expert advice and please take this advice seriously. Queensland, if we keep working together, we will get through this together.